Okay. Uh, First of all, actually, everyone should now, at least based on American guidelines, actually it's every 5 years. If it's normal, you should get it every 5 years. There are some other countries that might extend it to 10 years. That depends on your age. But to answer the question of who came up with these guidelines, well, there are several medical organizations that work together to combine the results of different studies. Now being American Cancer Society, one of the biggest organizations that is releasing these guidelines, telling us that colonoscopy should be done after 50 years of age and every 5 years. Because before, when the studies were not out, when the results were not out there, we were just guiding by instinct and our experience. So we were actually, instead of doing it less, we were overdoing this colonoscopies, and we were starting too young, so it was unnecessary. We have to remember that colonoscopy, even when it's a relatively safe procedure, it can, in certain cases, lead to very bad complications. So we try to expose our patients less by actually doing everything based on evidence. So American Cancer Society is number one that we use, and actually is the one that tells us to do it every 5 years. But there are many other. I don't know if you know other societies, Dr. Martin.
Oh yes, Lorna. It says that it takes almost 5 to 10 years a polyp to begin starting with malignancy. So that's why the evidence of, for example, American College of Gastroenterology, it take the 5 years as a number, as a statistical number. But if a polyp is found and it's a malignant one, so you will need for American College, you will need another colonoscopy 6 months after the one you find the polyp that is malignant. But if the polyp will need another in 5 years. That is the reasons I know, the numbers I know, yes.